Hello and welcome to Andean Medical Mission. Welcome to our series Beyond 2020, the series where we try and share our experiences in attempting to eliminate avoidable blindness in a country that has developing eye care services, with the aim to help other people doing similar type of work across the globe to learn from our experiences and to share their experiences with us. So today we're going to talk about what actually goes in, what are the steps that go into setting up an eye care project. What are the steps that are required to make it efficient and safe and enjoyable for everybody? So let's talk about that. The very first thing that you need to decide before you do an eye care trip is, what is it that you're actually trying to achieve? What is the problem that you're trying to solve? And once you know that, then everything else kind of falls into place. So a lot of what I'm going to talk about today is our surgical work. So where we bring UK surgeons into a village or into a town with the aim of doing 100 to 150 cataract pterygium operation. A big part of any trip that you do is, how are you going to manage the follow-up? So you're going to bring teams in perhaps from the UK, or you're going to manage this yourself, or you're going to bring in local expertise. But part of your planning is, what are you trying to achieve, and then how are you going to follow up, how are you going to make sure that your patients are safe after everybody has gone. And that's an important step to put in right at the very beginning. Once you know where you're going, then of course you can decide the size of the team that you're going to need. So this June we're going to a very big place called Riberalta. It's a town in Bolivia, which is probably the biggest place we've ever tried to work in. There are 100,000 people that live close to Riberalta, and if 1% of the population is blind, like nearly always in Bolivia, then we're going to have 1,000 blind eyes to operate on. So I'm going to need to bring quite a big team for this trip. We're not going to be able to do 1,000 operations, but we can do 100 to 150. So we're going to prioritize the people that are most blind. So patients that are bilaterally blind first, patients that are at risk of losing the eye from very, very aggressive pterygium, for example, and we're probably going to focus on those two diseases and skin tumors, which of course can be life-threatening, can certainly be sight-threatening as well. So we're going to focus on those three things, and I'm going to need at least 4 surgeons, and I'm going to need to support those surgeons with optometry, screeners, translators. So I'm going to need a team probably of 6 or 7 people for my June trip. You also need to think about what services actually exist in the town that you're going to. So if you go to a town and there's no ophthalmology whatsoever, then great, you can operate on everybody. You can do everything that you need to do, and do your follow-up and leave. But if you're going to go to a town where there is an ophthalmologist, or there are several ophthalmologists who are trying to build their practice, trying to build their business, if you like, then you need to think about the impact that your trip will have on what they're trying to achieve. This is especially important if you don't plan to return to the same areas all the time. So if you're trying to cover an entire country and you're doing one trip to every big town over a 10-year period, remember that if you go into a town and you treat everybody for free, and you give out tons and tons of glasses and things like that, that you're just basically undoing what the local ophthalmologists might be trying to achieve. So working with them is really important, and you're going to find that some ophthalmologists are really, really happy that you come. They want to learn from you. They may give you a list of equipment that they would love to have. If you can bring some things for them, that's great. They might be charging really good prices for their patients, and you coming in doing everything for free might just set them back 2 or 3 years. Equally, you might go to a town and the ophthalmologist there has a whole ton of blind people, but they're just not interested in those people that can't pay. And some ophthalmologists chase very, very high prices. They buy good equipment, which is great, but they're chasing the 1 or 2% of people in their area that can actually afford their services. And I'm talking about, you know, ophthalmologists that charge $4,000 or $5,000 to do things that you could get done in the UK for £1,500, £1,700, something like that. So excessively high prices. And if you go into a town like that, then yes, there's a whole ton of people who are not going to be able to afford local services. And so I think doing free stuff in that area is perfectly acceptable, because you're not taking their business away from them. You're just helping people who can't access their business. So that's all part of your planning, choosing your town, choosing the size of the team, and looking at local services with the aim that you don't destroy anything. Your trip needs to leave the country better off. It needs to leave, yes, individual people better off, but it needs to leave something for after you've gone. The next step is choosing your team. So you've decided what you're going to do. In the example that I'm going to give now, we've decided to do a surgical trip. And we have a local ophthalmologist who we're going to try and assist. So you're going to need to bring in a very skilled surgeon, someone to lead your team, someone who has done many operations. And you're probably going to need somebody who has done many manual small incision operations, or many extracapsular operations, because you're going to find that most of your cataract won't phaco very well, especially if you're using lightweight portable equipment. Maybe some of the world's best big heavy phaco machines will do a little bit better, but largely you're going to get better results just doing M6 for everybody. If you do ECIs, that's fine too, and you can get a good visual outcome with an ECI, but you're going to need to plan into your process somebody to come back in 3 months and remove sutures. You're going to need somebody to lead the team, and that person needs to have experience. If you just bring a group of phaco surgeons, you may run into trouble, and you're going to need to select very carefully the patients in your town. And it might feel a little bit weird to be operating on people who are perhaps 648, 660 just purely because you have a phaco, and leaving people who are perception of light and or hand movement vision, which is much worse, just because you haven't brought somebody who is skilled enough to do that operation well. You need to think about how you're going to get in and out as well of the town. So if you're going to a town that can only be accessed by a Cessna, then your team needs to reflect your transport possibilities. So some of our smaller villages, we work with 4 people in mind when we're building our team, just purely because 4 people plus a pilot fit into a Cessna. You might be able to make multiple flights. It's quite expensive to do that, and you can often do 100 operations with just a team of 4 people. Appoint a lead surgeon who everyone is going to respect and everybody's going to follow ultimately. You want to avoid clashes of personality, you want to avoid clashes of style, and you want a team that is happy, that is able to cope with the environment that you're going to put them in. So if it's very, very hot, if the food is very, very limited, if the hotel is uncomfortable, then again, part of choosing your team is putting people together that can cope with the environment that you're going to put them in. And you can do a lot to make things easier. You can hire portable air conditioning units, you can bring food if you're bringing an amazing surgeon, but they happen to be vegan, to northern Bolivia, for example, where everybody just eats meat and rice and occasionally potato or yucca. It's a very hard diet for a vegan, so you can make them more comfortable by bringing things, but that's all part of your your team planning, put the right people in the environment, particularly if it's a harsh environment. You're going to want active people, people that can cope, people that are resilient. You want problem solvers. You're going to need a certain amount of time to build your team. In the UK, study leave can be sort of 3 months, so you need to pick your team relatively early so that everybody can get permissions from the hospital that they're working in order to meet the deadline or the dates that you select. You're also going to need to do a certain amount of legal work to support your team so that when they're in country they are working legally. In our case, it's a really simple system. We get a qualification, so a certificate from each of the surgeon. Downloading the GMC online certificates is good if you're in a country that understands that system, but it doesn't look very much when you print them off like a certificate. It kind of looks like just a typed page that anyone could have made. So sometimes having a certificate with a seal or a stamp or something that looks a bit more like the certificates that are produced in the country you're working can be useful. But certificate for everybody, translated into the language that will be necessary, so in our case Spanish, and then notarized and legalized if that's a requirement. You may need to put it through the embassy as well. They sometimes want an additional legalization at the end, and you may require visas for working in the country. That's a moot point. Some countries will accept that if you're not being paid, so if you're not paying your surgeons, they can come out as kind of medical tourists, and other countries will say, no, you are working even though you're not being paid and you need a work visa for that. So again, allow the appropriate amount of time for that. So the week one, once you've decided the team that you're going to invite and they've accepted, you need to be starting on that type of work. So you've chosen your team, you know what you're going to do. Now you need to go and visit the site where you're going to work. This is really important. You can't very easily do this all by telephone, or I would recommend that you might be able to do some of it by phone, but going to the village just can set set the tone for what you're trying to achieve. In Bolivia, most of our hospitals that allow surgery within the hospital will do one operation a week. Maybe some of the bigger towns will do an operation per day, maybe 2 per day. And you're going in there and you're expecting to do 10 to 15 operations per day. You need to set the tone of that early so that people understand that things are done quickly. And it's little things like the level of cleanliness and the number of times that you want somebody to come back in to theatre, for example, to keep cleaning, to empty bins, to wipe tables down, all of that kind of stuff. You need to set the tone of that. So you need to visit the hospital, you need to meet the doctors that are going to perhaps help you with screening, you need to meet the nursing staff for theatre, explain how you're going to set things up and how you want things to run. You're going to need to meet with the mayor or the person who is in charge of paying for the trip. So if you're having accommodation, for example, or food provided by the town, then you need to go and agree the level of that. I personally insist that each person who comes on our trip has their own bedroom. I think when governments get involved, they try and stick 3 or 4 people in the same room, and no one sleeps well. And so sell the concept that your surgeons can be working really late, they can be working really hard, and they need to have a good night's sleep. Otherwise, we won't get through the volume of work that we're intending to do. So set that concept. If you can get air conditioning and get a decent hotel that is close to the hospital for walking, then great. That all helps with everybody's attitude, their happiness on the trip, and that helps you ultimately as well with the results that you get for your team. So go and set that up. If you have vegans or vegetarians joining, go and meet the cook and tell them, that vegetarians don't just eat tomatoes, lettuce, and chopped onion, which we have had served to us on a couple of occasions in Bolivia. But send them menu ideas. ChatGPT will give you a whole ton of menu ideas for vegans based on the country that you're living or you're working in and the food that's available there. So go and give them ideas, get them thinking about the quality of the food. Again, people being well fed, comfortable, happy, that the food is clean and well presented as well, so that you're not then getting your lead surgeon going down with 2 or 3 days of vomiting and diarrhea. That just blows your trip out. So getting standards set for food and accommodation is important. I would also recommend within the hospital that you try and keep the same people, because there's a lot of training that's very, very basic that you can do. If you're training someone to take pressures, for example, on the eye, you want the same person. You don't want somebody coming in the morning and then another person in the afternoon and then each day a different person. To be efficient, you want the same people, and particularly in theatre, the same people that are going to take your instruments and clean them. Then you don't have to keep explaining that please don't scrub capsulorhexis forceps with a big scrubbing brush. You'll destroy them. The people that wash, if you're using reusable drapes, which we do, we have a cloth drape that covers the patient, and then we put a disposable plastic drape over that. So we wash the cloth drapes, we rewash hand towels, and we sterilize those again. So all of that needs to go through the sterilizer. So having somebody to wash it properly, explaining how quickly we want the turnaround of all of these items to come back to us. If you have the same person every single day, or the same couple of people every day, that makes a huge difference. Transportation, book that early. So your flights to the village that you're going to, don't leave that to the last minute and find that another group has booked flights. Book those early, and also book early someone who's going to meet your team when they arrive in country. It's nice to be welcomed to country, particularly if your surgeons and your team have paid their own flights, they've given up time away from their family to do this. They may have given up their entire year's holiday to come and do this. A couple of agreements that need to be signed. Once you've got your team, get a team agreement in place with everybody. Ours is very, very simple. It's probably not binding in law, but it's binding in honor, and it's just about attitudes. It's about working hard. It's about trying to cooperate, following rules and systems, and giving everybody a process to follow. If they are unhappy is also an important part of a team agreement. So what do they do if they have fallen out with another team member? How do you resolve differences of opinion, differences of working, and particularly what happens if two surgeons disagree on treatment for a patient? So having set all of that up in a process right at the beginning, appointing a lead surgeon or a lead director of the trip. Having a way for the team to get to know each other before they all meet in country is also quite useful, and things like WhatsApp groups where people can share what flights they've found at good prices, where people can get to know each other a little bit, talk about their experiences, and maybe even have a meeting before they actually come out is a good idea, so that on day one people got a little bit of an idea of who the team that they'll be working with are, and sharing ideas before actually coming to country can be a nice way of getting people to work efficiently together quickly once they arrive. The health of your team is also an important consideration for you as an organizer. So before everybody comes out, you need to look at what health risks will present whilst they're in country. Do you have malaria? Do you have chikungunya? Do you have hemorrhagic fever? Do you have dengue? And what can you do as an organization to mitigate risk? And it's important that people can vaccinate against as many of the the risks as they feel comfortable to do. You need to discuss that with your team and get vaccinations, get medicines in place, get a really good first aid kit for yourself. Equipment needs to be checked before the team arrive. Having replacements, making sure equipment works is super important, and that all needs to be checked in good time for the team to arrive, and in good time for any engineers to work on your equipment, or any replacement parts to be purchased and to get through customs, or to get to invest in things like power surge protectors, and get all of that to protect your equipment, because you don't know the quality of the electricity necessarily of where you're going to be working, but assume that it won't be stable, and assume that your equipment could be damaged by power surges, power cuts, and then power turning off and then straight back on again can damage your equipment. After you've made all your applications for your legal work, you need to distribute a letter of permission to your team to help them to get into country, especially if they're bringing medicines and consumables with them. So we have a system where we buy everything we can in country, but there are medicines that we can't get here, and there are consumables that get donated to us, and we actively write to different organizations and ask them for the items that we can't buy in Bolivia. And pharmaceutical and device companies have been amazingly generous in our experience of 15 years of doing this, in supplying first-class equipment to us, and making donations year after year of medicines that keep our patients safe and allow us to do the work that we do. So you need to think about how to get those into your country. You might be allowed to bring them with the surgeon or with the medical team that are coming, and in our case we are allowed to do that, but they'll need to have a letter of authority to bring with them to help them to get through customs. Otherwise things will potentially just be taken off them. They'll probably still be allowed into the country, but the medicines and consumables can be taken off them. Spread it out is my point. Make sure that not just one person is carrying all of your absolutely critical medicines, and give the passenger permission to bring it through. So a letter from the Ministry of Health is what we provide them, and yes, every year we have suitcases checked, and every year we show our letter, and up until now that has been perfectly sufficient. If you're going to post them to yourself, then allow time for delays, and allow time to get your medicines through. The customs, especially if your medicines don't have a license in the country that you're sending them to. So you need to be aware of that, and to put into place systems that allow your medicines to come through, if that's at all possible. Otherwise, buy everything you can in country, but it can be very expensive, to try and provide a clean new instrument for everybody if you're paying ridiculously high prices for them. For an example, a stab blade, we will use it once and we'll throw it away. Because we largely have them as donations, but when we buy them, we pay $2 for them. Here in Bolivia, they can be $25 to $30 each, which then tempts you to perhaps clean them and re-sterilize them, and then you're lowering the quality of what you're doing. You're introducing more risks to your patients. So having the right quantity of stuff available in your country is super important. You need to start the process of getting that imported into country or brought with your surgical team as early as you possibly can. The final point really I want to make on this is arrive at your working destination before your team or your main team do. Utilize the time that you have. I normally leave at least a week before my team arrive. That allows me to travel by road safely and carefully to the village that we're going to work in. It allows me to unpack, to set up a clinic, set up the operating theatre, get things cleaned, get things changed, remove light fittings from theatre, get staff trained in terms of screening patients, and it's even worth screening patients before your team arrive as well, so that on day one, you have 8 to 10 people ready to be operated on. They've been screened, you've done their biometry, your surgeon will want to look at them for sure, but that they're ready. You don't waste that first day. We're looking for cataract and we're looking for pterygium, we're looking for skin tumours. So having a couple of days before the team arrive to find patients so that you on day one at 8 o'clock or 7 o'clock, whatever time you decide, you're ready to go. Just makes the trip more efficient, and it's much nicer for the team to arrive and to not have to go through all that unboxing, to look straight at theatre and see, okay, this is how Dave set it up in our experience or in our example, and to make a few tweaks to it, but to know that everything's set up properly. This is how it's going to work, this is where we're going to clean, this is where we're going to block. All of your sets are ready. Normally we have a meeting in clinic where we go through how to use all the equipment, and we have a meeting in theatre where we look at the microscope, we look at the phaco and the medicines that we've got, systems that are there to follow. We go through the surgical protocol maybe once again, and we pick our instruments based on the sets that the surgeon wants to actually finally use, and then we get the first sets ready to be sterilized. I don't tend to sterilize them the night before. I think it's better to practice to get in early on the Monday and to know that your stuff has been sterilized and hasn't been sitting overnight where maybe someone touches it or an insect runs across it. So I think it's better to sterilize your stuff on the actual day that you're going to operate. But those are the steps really. Building a team based on your objective, getting your legal work done, getting your equipment in place, and transport and health of your team, and being ready to receive them when they arrive at the airport, and again when they arrive at the village where they're finally going to be working, and making sure that your teams are happy, that they have a working agreement, and that you've made every effort to make them comfortable and feed them well while they're there, so that they return again, but more importantly, so they feel happy in their work, and that translates very much into outcomes for your patients and satisfaction ultimately for the trip. So that's it. I hope you've enjoyed this talk. It's a little bit rambly, I accept that. Hopefully you've enjoyed the talk though. If this has been useful to you and you'd like to follow the series beyond 2020, I will be making many more videos over the next year, just sharing what we've learned, the practices that we do. I'm very happy to interact, so if you think that there's a better way of doing something than what I'm suggesting, I'd very much like to hear that. Please please subscribe to the series, comment on it, share it if you can. That's all very helpful for what we're trying to do. So thank you if you've listened this far, and I look forward to seeing you on the next one.